Hi there, and welcome to another episode of Weekly Wellness. I'm your host, Amy Green, and again with me today, our very, very dear friend, Lynn Gerrits from the Simonds Cancer Center up at the Burbank Hospital facility. So thanks for being here again.
Thanks for having me, Amy.
Yeah, and you've always got a plate full of stuff going on.
We do. It's exciting stuff.
It is very exciting, and it's good for the community, and it's good for patients.
Right.
You know, in the surrounding area, we always say you don't have to go to Worcester, you don't have to go to Boston to get good cancer treatment. We've got a facility right here that will take very good care of you. So
very true, very well said.
You know, kudos to you, because I know it's a huge job, it's a huge undertaking, but you've brought the center so far. So
well, it's a team effort, and actually, you know, I should preface by saying that I'm here. You know, I manage the Simonds-Hurd Complementary Care Center, which rolls into the Simonds-Sign-On Regional Cancer Center at Health Alliance. So, I mean, the cancer team up there is phenomenal. My husband was a patient treated there and received fabulous care, and so it's really nice to pay it back and pay it forward, and help meet the needs of the patients, because I saw firsthand what treatment can do to a cancer patient. And not only that, as a caregiver, how much support and healing a caregiver needs.
Right, not only during, but then after.
All along.
And continued.
Survivorship, even for the caregiver, because there's always adjustments to be made, absolutely.
Right, and there's a grief period with that comes along with that. You know, it's, if you've been a caregiver for any length of time, and then your loved one or whoever you've cared for passes on, you grieve that, because your life changes, because you're no longer having the hours spent caregiving.
Right. Well, and there's the grief with going through it and adjusting to what some people think is the new normal, or just, you know, kind of shifting priorities. You know, when someone's diagnosed with cancer, it changes not just the cancer patient, but everybody who, you know, is in their life. You know, work priorities, home priorities, responsibilities change. So there's a constant adjustment. So
well, it's a community involvement.
Totally.
When there's a diagnosis of cancer, it's a community involvement.
Absolutely.
You know, friends, family, work, you know, spiritual, you know what I mean, your extended friends. So it's important that people know that, you know, that affects everybody.
And that's what we try to do at the Complementary Care Center, integrating our services into the Cancer Center, is to help, you know, fill the gaps where, you know, medical treatment stops. Healing needs to happen. So we like to try and provide and offer those services that are therapeutic, supportive, healing, nurturing, empowering, so that the patient feels that this is what I can do for myself to feel better, to help, you know, relieve some of the side effects of treatment, and to improve quality of life overall, because, you know, it really does knock your socks off when you're going through treatment. So, you know, whatever you can do to feel empowered and say, I'm taking control of this. Cancer's got control of me, but I can take control of my healing and how well I feel from on a day-to-day basis. So we're very happy and proud to be able to do that.
Yeah, and you should, because the facility up there is just beautiful, and you offer, you know, all different kinds of modalities and treatments and supportive help for everybody. Go through that list now of all the services that are offered there.
Do we have enough time?
We do. Yeah, because believe me, we'll get to Angie's Spa. We will get to it. But I want people in the area, because there's still so little known about it.
True.
You know, Complementary Care Center, and that's exactly what it is, complementary care.
Correct, yes.
So go through that list of some of the modalities that you
Absolutely.
offer.
Thank you. And designed to be used in addition to traditional medical care, you know, complementary modalities should always be used connected with, you know, so that providers, you know, the physicians, therapists, whomever it is that you're working with for your care, should know that you're seeking out these additional services not to be used in place of. And so we preface all of our conversations with patients and clients in that way, that they should be using them in concert with. So many different forms of massage, including oncology massage. So we have a massage therapist with additional training to work with the special needs of a cancer patient. In addition to that, she also is trained in complete decongestive therapy, which, if people have heard of lymphedema, so a breast cancer patient, for example, may develop lymphedema after excision or, you know, biopsy of a lymph node. So it's a swelling, and so she's trained to deal with that and to provide the full spectrum of massage and treatment for that. We have our standard, Swedish deep tissue, sports, reflexology, prenatal, hot stone, cold stone for migraine relief, reflexology. And then, of course, we have acupuncture in private sessions and community sessions, which is going to be less expensive than your private session. Hopefully making it more amenable, because we recognize that not everybody can afford these out-of-pocket services very easily, because insurance doesn't cover most of these things.
Right.
We have yoga classes, but also private and semi-private therapeutic yoga sessions. We have Reiki training for all levels, and other classes include Tai Chi, Qigong, fitness classes, strength training. We're starting aromatherapy and even belly dancing.
Wow.
Yeah, we have an open house this Saturday from 11 to 5, so people can come and try these classes, a half-hour free demo, and try it and see if they like it before they, sign up for something. So we have a wide range of services, guided imagery, stress management, the Prepare for Surgery, Heal Faster program that I manage that. And for people getting surgery at Health Alliance Hospital, they can take that workshop with me for free. So it's really, and it helps them alleviate anxiety going into any sort of procedure, and it helps heal faster afterwards, and actually increases, hastens discharge, because patients find that they feel that much better and need that much less pain medication.
Right.
So we have a wide range of things, and volunteer programs, Reiki volunteer, and of course this wonderful Angie Spa.
Right. So let's talk about that, Angie Spa. So it's a different leg. You're like an octopus up there. You got all different kinds of things going on.
Well, because the Simonds-Hurd Complementary Care Center is philanthropically supported, we're not funded by the hospital at all. So it was started from funding by Gail Hurd back in 2009. She awarded the money. We opened in 2010. And so because we are working to be self-sustaining, we don't have a lot of funds to provide what I believe should be free services for cancer patients.
Right.
They're already dealing with enough. They really shouldn't be opening their wallet to feel better. And like I said, having had a husband going through treatment, I recognize that. It was just very near and dear to my heart. So I'm always looking for opportunities for us to provide low to no cost services, therapeutic services for the patients and the caregivers. So I happened to come across Angie's Spa, kind of mentioned on, I think it was Memorial Sloan Kettering's website, just mentioned there, and sought them out, and she was just very impressed that I actually even found her, because they had only been funding 4 hospitals at that point throughout the entire country.
Wow.
So here we are, little Health Alliance Hospital, seeking out the grant, and our first grant last year, which we just finished, was awarded for $15,000. So that allowed us to offer free acupuncture, massage, and yoga to the cancer patients.
That's
so
awesome.
Isn't it
Good
fantastic?
job. Yeah.
So far, I think, let's see, massage, which includes hand, foot, and chair, we've been able to offer probably over 500 throughout the year. Acupuncture, probably close to 200, and yoga, about 80, 84, somewhere around there.
Wow, great numbers. I mean, that's just awesome.
Yeah, brand new program just getting started. Yep. And of course, a lot of it is educating the patients that what these services truly are and how they can help them, because they may not understand that, yes, you may feel well now and you've just started treatment, but it's going to hit sooner or later.
Right.
And you don't want to be kind of scrambling for, how do I manage these, and most people are really tired of taking so many medications. They don't want to take just one more to help manage the pain or to help manage the nausea or fatigue or so on.
Right.
So these therapies can address a multitude of side effects of treatment. Acupuncture, for example, can help with peripheral neuropathy, which is the pins and needles that patients often experience during chemotherapy. That, the pins and needles and the pain in the extremities, fingers, hands.
Right.
So we have patients loving it for that, and the nausea, of course, fatigue, insomnia, so many different things. Pain, of course.
So Angie is a real person.
Angie Levy lost her battle to breast cancer at the age of 36 after, I believe, about 9 years. And she had a zest for life. I never had the privilege of knowing her, but I've read about her, and she had a zest for life and loved the little things, loved being able to pamper herself. And so it just kind of made sense to her family and friends that if they were going to start this foundation in her name, that this is what the direction they wanted to go in, was to provide those things that made you feel better while you're going through treatment.
Wow, that's awesome.
Yeah, so it's totally supported by donations. Angie Spa is always asking, they have a board of directors, they have fundraisers across the country that they do. The hospitals that and cancer centers that they award the grants to are also charged with doing what they can to supplement and to continue to bring in funds. So for example, with us, we'll have fundraisers throughout the year, whether it be a comedy night downtown. Some of the fees from our Reiki training will go directly to support that and to help augment those funds, so that we're not relying as much, and especially with us being philanthropically supported, it's a challenge, but we're stepping up. And we got awarded our second grant this year by Angie Spa for $18,500 with matching funds of $1,500 for a total of $20,000.
Wow, great.
So we're very excited.
Yes. Yeah, because think of how many services that will provide.
Exactly.
Right.
Exactly.
And then people don't have to worry about, I can't afford it, or that would really be nice, but how am I going to do it? Taken care of.
Exactly.
Yeah, and that's what you want.
They love when we just tell them it's free.
Right.
While they're getting treatment, yes.
Yeah.
So while they're literally sitting there in their chemo chair, or before or after radiation, they're able to get acupuncture. So it's nothing to be walking down the hall and look in the treatment rooms and see someone getting a foot massage here, someone getting Reiki over here, someone getting acupuncture here, someone working with the yoga therapist over there. It's great.
Right. And how awesome is that, what I mean, to be walking, through the cancer center and seeing that going on. Talk more about, why you do it.
Why we do it. Cancer has touched the lives of so many. I'm sure everybody watching has been touched by cancer in some way, shape, or form in their lives. And so if you've known someone who has had to go through cancer treatment, that it's no picnic. You've seen them feeling fatigued, not feeling able to participate in normal activities of living. Maybe they've had to cut back hours at work if they can even do any at all. They're dealing with bills. The challenges of the psycho-emotional aspect of things, of trying how to talk to family members about it, and so on and so forth. So everybody who has worked with a cancer patient truly wants to help.
Right.
And when I facilitated the American Cancer Society support group for caregivers and survivors, I would often share with the caregivers, when people say, how can I help you? Give them a task. So to be able to be in this situation where we have these services and a patient is clearly in need, it's great to be able to say, we can help you.
Right. Now, does this, is this all hands-on work, or do you do any emotional or spiritual counseling or anything with this portion?
So Angie Spa is specifically for those therapies that I mentioned, the acupuncture, massage, and the yoga. Now, yoga is basically a spiritual practice. So Julie Pepper is our yoga therapist. And she does a beautiful job working with the patients and caregivers, and that could be family or friends. It could be whomever came with the patient that day. They both have needs. And so she works beautifully with maybe doing a meditation with them, helping them kind of go inward and find that space with the breath and the body where there's peace. And so regardless of someone's faith, it's very spiritual, because how often, anytime we go inward, that's a spiritual journey.
Right.
So she's able to work with them on that level. The Cancer Center does have a 20-hour-a-week deacon who's non-denominational, and so he works with the patients and the caregivers and the staff as well in terms of their spiritual needs. They're also starting up new support groups as well. So we have two wonderful social workers, and we have 2 fabulous patient navigators. And so the 4 of them, actually the 5 of them, including Deacon John, they meet the psychosocial spiritual needs of the patients and the caregivers.
That's awesome. So it really is like an all-encompassing